Welcome back to Leonard Brothers Veterinary Centre's Arthritis Talk. We're on to the last home stretch, and E is for exercise. Most animals that have arthritic joints, if we then go through the A to D part of it with the disease modification, the comfort, the body weight control and the pain relief, we can then start an exercise regime that is suitable for that animal and hopefully will help reduce its body weight, help get it back to enjoying life. Now, early exercise in puppies is a brief word about this. Skeletal maturity varies with the size of dog. Smaller breed dogs will actually mature much quicker. So by the ages of about 6 to 8 months, their joints are fully grown, they're wrapped in muscle, and they're nice and stable. But your giant breed or your large breed dogs take a lot longer. Giant breeds can be up to 18 months to 2 years before their joints are fully stabilised and wrapped around in muscle. Think of them very much like probably I looked when I was 16. I'm all knees and elbows, very gangly. Those joints are knocking around, and if we exercise those animals too hard, then we are going to cause damage to those joints early doors. So careful exercise of any large breed dog until they've filled out, until they're well muscled and they've got some stability to those joints. Exercise. Exercise is very important. Exercise is good for you. But one thing to remember is sport is bad. I know I'm going to have arthritis when I'm older. I've already started to get some chronic changes in my ankles because I've sprained them so many times, chasing basketballs, playing rugby. It's basically hard work over a whole life. And it's the same is true for our dogs. Careful exercise is really good, but our dogs don't think long term. They think about chasing that ball, jumping off that wall. So we have to impart some control to make sure their exercise is appropriate and they don't overdo it. For that reason, we will look at animals that come in and have been diagnosed with arthritis or have had surgery, and we get them on an exercise plan. So at the top we've grade 5, where is no exercise at all. And that's basically cage rest, room restricted. These are for animals that have basically had surgery and we want their bones to heal back together, or we don't want them to disrupt any surgery that we've done. As those exercise levels go up, we go 4, 3, 2, 1, you can see that we start using things like hydrotherapy at number 4, minimum impact, short lead only, toilet requirements on flat ground, hydrotherapy and physio. Hydrotherapy is brilliant exercise for dogs, especially if they have joint problems, because we want them to move those joints, but we don't want them to load them. So when they're in the water, and that can be at a hydrotherapy pool, which we can put you in touch with one locally, or swimming in the outdoors. If they're a dog that likes to swim, that's going to do their joints the world of good, because they're moving, yet they're not having to bear their own weight. The water buoys them up. And that's excellent exercise for a dog with sore joints, and it helps with their weight loss program as well. As we get increasing control over their body weight, their comfort, their disease, we then start to increase the level of exercise. And again, as I said, sport is not good for you, and that's true for our dogs. So even at level 2, some off-lead exercise, so they're not just on the lead, they are not allowed to just go knocking around with any other dogs, because they won't think about the level of exercise. They'll jump around, they'll hoon about, and then the next day they'll pay for it when they're stiff as a board. Hopefully, if we get on control of all of these processes, we can get them up to level 1. They're allowed to do some jumping, and jumping can be pain-free if we've controlled all of the other things, A to D. And you can see 2 Jack Russell Terriers enjoying the local terrier racing course at one of the village fetes here. And even with some animals, if we catch them early enough and we do get on top of their pain, we do get on top of their body weight issues, their comfort, their disease modification, we can get them back to normal exercise and normal activity, as long as it's safe to do so and that they are responding well to the therapy. We can get them back to full fitness. And for some of our dogs that have come into us with arthritic problems, this is the level of activity they've been able to get back to. We have a couple of members of Whitchurch Dog Display Team that have got arthritis, but because their owners are very attentive, have picked them up really early, we've been able to actually control their symptoms, halt the progression of the disease, and they're back to full work and loving it. So, in summary, across all of these videos, we've got to remember it's a painful progressive condition. that early intervention is crucial, because once that cartilage is gone, we can't get it back. A multimodal approach, analgesia, body weight, comfort, disease modification and exercise all play a role. Each individual patient will require different levels. Some won't need pain relief, some will just need disease modification, some will just need to get their body weight under control, and their requirements will change over time. So even animals that we start on pain relief, we may be able to get them off pain relief once their body weight has come back to normal. Thanks very much for watching these videos. It's been a bit of a challenge putting them together. Hopefully they've been helped in some way. If you still have any questions, please use the form on the welcome page of our website or pop into the practice and have a chat with us. Thanks very much.